Oh, your team have capable for 10 crores, we need 20 crores. Then automatically what will happen? We have to search what type of grants and everything. Proposal. So who will give 20 crores just like that? When instead of 3 PI, we have to go for multiple PI, 6 or 7 on medical, life science, pharmacy, nursing, engineering. Put together, we brought out one particular proposal. That team is very, very strict PAN number, IIT teams. You know that, no? Even greater proposal, no, they will reject. Even greater proposal, because generally, being a private people, no, their point of view, we are good. But generally, their point of view, what will happen? Correct, no? So then we cracked that particular this thing. Okay, we brought one particular proposal. One is genomic side, because I am not expert on that. My side, I brought one particular proposal. Okay, sir. I'll give one nice proposal. I evaluated everything, all the proposal, where are the available website, what is the duplication. 100% guarantee this is the first novelty we are introducing to the market level. Okay, what is the proposal they are? I am a pharmacist. How dare you submit rocket science point? I told very clearly, you don't know anything. I know about drug. Correct? No, I know about the drug. But you may not be knowing what is the drug character. Okay. Then what is your third objective? Microgravity impact on stability. What is the mechanism? We are so comfortable on the ground because of gravity. Any molecule, chemistry people may be knowing. Chemistry, bonding, everything, knowingly, unknowingly because of G value. Am I right? G value, no? That is the thing, your material is supposed to be more stable. Am I right? Okay, G value minus what will happen? Hypergravity or hypogravity? Yeah, that's all very simple. I disclose 20 crores, we got it. No, little bit crazy. Maybe this example may be, because Nirmala may be knowing I am a crazy teacher during Vinayaka. But still I am fascinating on science, right? Huh?
So you're still working on this project or is
No, I am, see now I am one of the group of ISRO. Human space flight. You may be knowing that there is a center in space in Bangalore. So now they are recognizing as a team. We are a lot of people, not only single, engineering, lot of people, So now they recognize as a group. We are going to start, already we started the space center. They are sponsoring, we are creating one more space center at Bangalore. There we are supporting all drug related, 15 drugs recognized as the astronaut drug list. That all we are working on. So now what will happen now? Demand. ISRO inviting to apply the application. That is called as ISRO demand application. Respond application, 199 category. So they are asking, so now I can make it, no sir, I need 1 crore. Well, my demand. Because no such category, you can think about that area also. How many people pharmacology here? Yeah, correct. How we can create a microgravity on mice? Is a question mark now. Microgravity on mice, how it is possible? Is there any experiment? There is one experiment, incline, 90 degree, no, incline, you are adding microgravity, that we disclose. So the same applicable to the clinical side. The person supposed to be bed, no? So how long you can stand this manner? You stand and see, you can feel the microgravity. You can tilt and stand, no? You can feel the microgravity. There you can stand 1 hour, 2 hours, no? Animal physiological function completely different. This model we given animal model and human model, now they accepted that proposal. That is the same problem happen in the William now. William facing a lot of problem, no? Calcium deposition and all, no? This is the same problem. Now people are realizing, now immediately they made a committee. They are attracting whoever is supposed to be expert on this type of related physiological and drug stability. Other rocket science, we are not expert on that. Related to responded application, they said that we are working. Is there any related with the pharmacy? That is, I think, little bit crazy enough. Otherwise, nothing will work out. This is all what I am merely saying for the major grants. Any critical comments? That is the point. I don't want to see my slide and giving information. I am not such a person. Whatever experience possible practically, we can do it. Otherwise, you can leave it. That's it. Anything, any? I think this 10 to 15 minutes useful for you. I think so. Don't underestimate your lower level. Chutney example already given. You have a lot of ideas. See, we are merely human being. Don't underestimate your ideas, intellectual side. Understood clearly? No? Don't underestimate. You have a lot of ideas. Only problem, no, you are not showcasing. You have a lot of ideas. Am I right? Lot more ideas. A lot of schemes are available now. 400 plus schemes are available. Invariably start from 1 lakh to crores together. 100 crores projects are available. But how you are catching that right platform and the right application, novelty, no, that is a very important point. Very, very essential point. This is the point I would like to, yeah. Yeah, very good. Already simulation center we started. That is a great story. Because we don't know how to create the chamber, no. Microgravity on ground is very, very difficult. This I started reading so many things, no. Then there is a 8th standard book. People are making one small experiment, clinostat. How many people you know that, no? Clinostat machine. That is nothing but giant wheel. How many people experience giant wheel? Roller coaster. Yeah, which point you feel upward movement? Yeah, that is a thrill most of the people they are traveling, no? Yeah, that is a point microgravity. Because that we can create when you are rotating your material, one particular point, G value become negative, then become positive. That one particular value, we got it as a microchamber. That we taken the example from IIT. We are associated with IIT Chennai. There is one great professor, retired professor, is the only person understanding. That is called a strategy lab microgravity. I catch hold. I went Calcutta, I sent my student, trained. He created customized chamber for microgravity that is available in my department now. Little bit crazy. Again, I am telling because my total dedication on this type of thing only I am working. Apart from teaching is my fascinated. Till I am teaching a lot more thing. So like that, lot of experiment we have to do. One more challenge. First, my grants, I got 11 lakhs because merely looks like nothing. That is a great experience. That one major earthquake happened, no, 2014, 13-14, no, that Meghalaya, that Himachal belt, no. By the time my presentation in IIT New Delhi. So by the time what will happen, no, presented immediately that earthquake, no. So they dismissed and they told that after some time. So after some time we went and all presentation over. Looks all publication support, university support, all those things I given. Chairperson is almost 75 years old. What comment he given, no? Your font size not good, not visible. You know, how will they will irritate? How many people you experience, I don't know, they will irritate like anything. You should not feel bad. Okay, sir, what will do? Shall I change? No. What I could not understand, because I explained properly, no? Then, no, I am not satisfied. All the people supported, except one few people, no? This is also a negative side, you have to learn such a manner. Then I told that, okay, sir, leave it, because this project already successfully completed, lot more publication happened, because that is one of the product successful translated to the commercial side, international drug delivery system. Curcumin may develop one particular product. Some of the industries are waiting. More than that, 10 lakhs, I'll get the 1,000 crores also possible. But don't worry, sir, I don't want any financial assistance. I told I come out. I shown only one evidence on that, because they have to believe, no? Who invented international drug delivery system? Luckily, my fortunate, who first discovered that particular international drug delivery, he wrote a letter to me. Namaste, he is from USA. Alzheimer Association, father of. He wrote on mail. Gautam, this may be one day your product available in the market. All the best, he will support all the thing. Sir, only 1 minute, sir, I can show this thing. Then you decide yourself, then I show and I come out. You cannot believe 4 or 5 panel members come, discuss negotiation amount. Sir, how much you need, sir? Because by the time I quoted merely, because by the time you may be knowing such a reputed university, no pressure. Sir, without grants, we cannot survive. So they told that, sir, at least you give whatever. Sir, negotiate, finally they told 11.5 lakhs. That also they told us, no, sir, don't go this particular project. Instead of curcumin, we'll go for antiviral. Okay, do it. But I need a money. That is the first my experience of DSC SERB, International Drug Delivery System. So that also you have to prepare. So don't fed up of all the thing. Now that all the system gone now, because most of the system revamp, most of the application online itself scrutinized. Ranking system online itself is reflecting, and finally comments also supposed to be mandatory now. So don't worry about that particular traditional holistic approach and all gone now. Okay, right. That is a point I told that my experience I can share more than enough. These slides for you. Any other criticals? But time also very important. I don't want to enter your space time. Yeah, that is the early grants is an individual. You cannot combine. Nidhi Priyas. All BIRAC, big grants, everything independently BIRAC. Once you can visit BIRAC scheme, not DBT. BIRAC scheme, all independently you can start the company, anything, even till 10 crores they are supporting. Soft loans are available, 4% soft loans are available. Because, no. There is a only problem associated with the company. Because you are making product, am I right? Nidhi Priyas, they don't have any objection. When you can go for crossing 50 lakhs, now you have to associate it. Because who is your partner, they will ask. You are independent scientist. How to make a product? I need a manufacturing facilities. Now that we have to associate it. That is called a CRS scheme. No, they are expecting commercial product, that's all. Prototype. No, prototype, they will put it on website. How many people heard about that NRDC? National Development Corporation, Research Corporation, NRDC. NRDC is the scheme. DSAR, you know that, am I right? DSAR, you heard about that, am I right? DSAR is a part of NRDC. NRDC is the official forum, government forum, you can place your product, prototype product. So that product, look at that all the people, they will come forward, they will fund you. Suppose you are posting one particular, your product posting NRDC. NRDC itself, they are giving 7 to 10 lakhs for prototype preparation. Independent project, it is all. So that prototype you can post on NRDC website. You can visit, you can understand. So industry people interested, they will come and private grants you can get it. It is possible, no? Yeah. It's individually, no, women's scheme. Individual, yeah. Now, why people are asking individual? Is there? No, you tell that I can clarify, because most of the institutions, they have their own limitation. Individual means, suppose you want to associate on co-PA, is there any problem? Okay. No, that independent I is supposed to be understand rightly. Only pharmacy field you want, No, single person, all the grants as a PE as a single person. See, my grants, all the things single grants only. But without, see, for example, my field of expertise pharmaceutics, no? But I include animal, then I need one co-PA, no? See, microgravity, I need a physics person. Yeah. That is your wish. Yeah, that is a single institution or multi-institution platform, that's all. Two things we can. This is the Nidhi Priyas I told. That is the Nidhi Priyas and the DBT, Bayrak, all independent. Even including 10 crores we can go for. Soft loan. You have very good business model, great and great support. That is the best option I am giving my students now. So many people entrepreneur become now. They started their own company, cosmetics company, so many things. Now they'll got the fund, they manufacturing, they are selling now. Even one of my students recently are selling the cereals powder, stability, more stable cereals now, powder and all, that we are selling now. He got little bit financial support. Now, finance to finance is getting now. Cereals, manna powder, sir. Example, solra. He is doing the business now. So this is all the thing possible. But only thing we have to work out, prototype, startup, some startup. Now, that is the best option. ERODE is a state entrepreneur association. Name is Elango, I think so, Elango Gopi. So they are supporting a lot. For entrepreneur association available, most of the time I'll call. They are supporting a lot. If you want to become an entrepreneur, startup company now, is the best option ERODE built. Possible anything, because so many options are there. Last point, maybe with your permission, don't think about always depend the grants from government side. So what is the other opportunity? That is called as private grants. Private grants highly appreciated by UGC, NAC, NIRF, all those. Suppose you have idea. Means? You have idea, they will invest on you. See, for example, we worked with Sakti Masala, no, here. Sakti, you are built only, no, that one. You know, because I should not tell all the secrets. Okay, that Sakti Masala, no, there is a, when we can open the pack, no, you will get the very good aroma, you know that? You find out. Correct, no? And most of the shop, when we can cross ignore that the biryani smell, no. But when you are cooking, you are not getting, no. That is the reason we are attracting hotels, no. Whenever you are entering, most of the time hotel we are entering, but whenever we are cooking, that smell, what will happen? Value added essence they are adding. There is a limit, 1 or 2% of essence, even cardamom essence, no, you can add. For example, best example, I'll put it other manner. Cookies available, no? Cashew, rich milk. Is it possible for 400 ml of milk converted into 10 biscuits? That's how it is possible. You can add 4 condensed milk. Can you get the biscuit first? This is all Nidhi Priyasa, challenges all the thing. Again, what they told, they create the synthetic milk, 1 drop converted into 1 liter. That is a pharmaceutically people are using. That is all this flavoring agent for pediatric application shampoo. All pediatric infant shampoo, no, milk flavor. You know that logic you may be knowing. Because the first smell of your infant, mother feeding. So that is the first smell. That is the first milk smell. This is a recommended milk smell for all the pediatric application. So now they created one particular chemical. You drop into 1 liter, you cannot believe converted into 1 liter. Even you can touch, even couple of days, you cannot remove that flavor. Ghee. No, I don't want to threaten all the things. 90% of likely value-added product available in the market. Butter. No longer what you are using in the market is not a butter. Honey. This is all the business model. If we have stable, because the question is stable. Malaysia, you go natural milk tea, you cannot in Malaysia. You know that? The excellent tea I had. Even I tried, even I thought of that, will buy that particular milk. Excellent tea. Then luckily what will happen, that person, master, no, that is a Madurai person. Again, jovial, you know, he started, sir, idella milk illa sir. Idu soya landu pandra oru milk sir inga. Plus they are adding some chemicals and everything, no, excellent milk. They are not using natural milk there, except palm oil. This all value-added other side people are working on the research grant. Is all available for industrial private grants. Sir, உங்களுக்கு ஃபண்டு வேணுமா? நான் இது உங்களுக்கு எக்ஸாம்பிள் தான் சொன்னேன். See, adding preservative is good for bad. Adding preservative in the biscuit, adding alwa, preservative, bakery, people are adding benzoic acid. Is it good or bad? Anytime did you avoid? அவ்வளோதான் முடிஞ்சு போச்சு. See, this is an individual bias not suitable in the public side. Publical bias not suitable in the family side. Family myth cannot be suitable for your relatives. Correct? So where you need a challenges, we have to go for. Because since the government of India allowing the limit of chemical, we are using the limit of color, limit of preservative, challenges. See, recently we made a biopreservative for cosmetics. Because most of the time people are using, there is no such biopreservative available in the market. I am giving clue. I told no some of the example I given. Biopreservative is an excellent proposal. You find out any biotechnology, lot of vegetable, even you started tamarind, you used to preserve, no, you find out which chemical to preserve longer run. That is called as biopreservative. Because the biopreservative, again, the stability issue. Correct, no? You have to find out, that is a very good proposal. You can come for, not only, see, most of the proposal, what we are doing now, sending the government of India, you are giving authorized person to government of India. You cannot take it and do the business. You cannot do the business. Some of the proposal, you have to make it your own startup. Private grants. Best example, recently we got one ICMR, 1.5 crores, we got it. Simple manner. Humidity, no? Humidity, pollutant, gas and everything, no? How to remove? Because there is a lot of humidifier, filters people are using, no? We made one simple equipment, plant-based equipment. What are the plants we identified? That air circulator, because exhaust system we made that side. Whenever that air circulator routed through the plant. Because this is a system, how many people went Bangalore airport, no? That is completely looks like forest. The same vertical garden likely, one small instrument. Then we can analyze what is the ppm level of that particular pollutants and everything. Now, surprisingly, 90% reduce. So the same thing we wrote in ICMR. ICMR, what is the meaning? This protocol under this thing. Because they told that we'll incorporate it such a manner that suitable for hospital. So they sanctioned 105, that is a sustained project. Sustained development project, no? That also we got it, 1.5 crores. So now what they are giving rights, you can manufacture as your own, you can put it in the market, you can take a royalty, 60%, 40% to the government, NRDC. So they will make it one profile, maybe your profile we can add, that's it. Some projects, what will happen? Think and proceed. That is my conclusion remark. So anywhere, any point supposed to be want to discuss, you can call me, no problem. I can give the critical comment. Maybe that may be enrich your proposal or something, we can easy to cope up, no? Everyone knows that my profile is there. JSS, Department of Pharmaceutics, no, all my profile is, no problem. I think my session may be useful. Faculty development program, not merely, at least some of the take-home messages, no? Thank you. So thank you so much. Give an opportunity, share my idea, patiently listen. I don't know how much useful for your case. Okay? Thank you.
Thank you so much, sir. Thank you, sir. சார் சார் வாங்க சார் வாங்க சார் கொடுத்துருவோம்